So I was requested by by MDS and regarding this program to cover a little bit or to do an appraisal of the clinical trials in Huntington disease, at least the most recent ones, and look at them not just in the perspective of sharing the results, but also trying to appraise the methodology applied and in which way, we can learn and in my perspective, be more prepared for the follow-up, so meaning for the next trials. And if I may add something, again, in the field of Huntington disease, we are entering clearly a new era because we are finally starting conducting trials with compounds that we expect will really act at the level of the cause of the disease. So really, at upstream in the pathogenesis of the disease. So it's critical that we learn as much as possible from all other trials that have been conducted in the past. And because the expectations are really very high, to minimize the risk of failing. And failing means not just, again, failing in terms of the expectations that we are generating for all the community, but also not learning, meaning that we are not conducting trials that, even if they don't have the results that we expect, are not informative and not allow us to get more information, to be more prepared for what we will need to do in the short term. And what I can share, it's a little bit that when we look back and appraise the trials that have been conducted in the past decade, clearly there are some aspects that, in my opinion, can be improved. This means that we have been, in some way, extrapolated many conclusions from post-hoc analyses and conducting new trials based on those findings that after did not prove to really be in line of what were our expectations. So in some way, probably we were not as efficient as we would like to be. And clearly, with the new trials that we are now conducting, my presentation a little bit was like an alert saying, let's, as a community, try to avoid committing the same mistakes and not frustrating the high expectations that we have now.